Telok Blangah Drive Food Centre and market stallholders are requesting a swabbing exercise after a hawker there tested positive for COVID-19. It is among 3 markets in the Bukit Merah area affected by COVID-19 cases. Li Ying reports.
To keep the COVID-19 virus at bay, these cleaners are sanitizing every corner of Telok Blangah Drive Food Centre. Since a COVID-19 case was picked up here on Tuesday, the hawker centre will close for 3 days for deep cleaning. Stallholders are supportive even as their incomes suffer. In fact, they are hoping for more precautions.
Feedback from stallholders is their desire to undergo the mandatory COVID testing. Our team have provided this feedback to MOH and NEA. So we are waiting to hear the process.
If the Health Ministry gives the green light, the swabbing operations could be held at this nearby pavilion at Block 80D Telok Blangah Street 31. About 3 kilometers away, at Block 84A Red Hill Lane, a compulsory swabbing operation is in full swing for staff and tenants working at the 215 stalls at Red Hill Market and Food Centre. That's because an infected patient visited the hawker centre recently. Just a 10-minute walk from Red Hill Market is the Bukit Merah View Market, which now has a cluster of 25 COVID-19 cases. The Bukit Merah View Market is now closed for an additional 2 weeks. But residents living in the area tell me that it's common for them to visit both markets, and now they are worried that the virus may be lurking among them.
We make a very fast one. We buy and move off instantly.
There is a concern, but we are vaccinated and also we are wearing masks.
The Red Hill Market and Food Centre is still open, but hawkers say business is painfully slow.
他们误会是我们这边的红山85的 market 有人中了，所以生意就这边下了，就这下到60%这样。
Stallholders are hoping that no cases will be picked up at the market. Mr. Melvin Yong, who's the Member of Parliament for the area, has a game plan if there's a closure.
The Market Association representatives hope that there would be some form of support measures given to the stallholders if the market is to be closed. So I'm working very closely with the relevant agencies such as the Town Council and the NEA on what specific support measures we can put together for the stallholders.
The testing operations for Red Hill Market and Food Centre ended on Wednesday afternoon.
This food centre, about a 10-minute walk from the affected markets, is also feeling the impact. The Bukit Merah Central Merchants and Hawkers Association estimates business here has fallen by up to 80%. One doctor says it's not surprising that a cluster has popped up in a food centre where there's higher human traffic. She also says food from these places is not likely to pose much risk.
There is no evidence that people can catch COVID from food, especially if the food handlers are not going to be in direct contact with cooked food. Exchange of cash, while it could potentially be a concern, but the main mode of transmission is still going to be droplets from an infected person. So person-to-person contact.